Okay.
Ready? All right. So if you've read and understood, considering it communication skill station, please begin.
Okay. Hello, my name is Dr. Ala Abdallah. I'm a doctor in the surgical team for Dr. X. Can I confirm that I'm talking to Mr. Khalid?
Yes. Discuss your
Okay. Yes.
discuss the case, please.
I have got to speak about a patient who her daughter is want her to be discharged at home immediately, and she's has developed the complication recently, and her daughter wants to take her home.
Your voice is low. Please, can you make it high?
Okay. I'm called to speak to the consultant surgeon on call about the patient with developed recent complications, and her daughter want to take her home.
Okay. Can you summarize it?
Yes, we have a fragile lady who has been admitted to the hospital for mastectomy and auxiliary clearance for breast cancer. Yes. On the second post-operative day, she developed swelling in the axilla. And about this, we have started our management and investigation, but her daughter, she is very worried and wants to take her home. Yes, the patient has a background of COPD and he has a mild left ventricular failure.
Okay.
So I'm asking to your advice about this situation.
Okay. But first, did she make her own decision or did she was bullied? Was she bullied by her daughter?
Well, we don't know that yet, doctor, but I will check out this.
Okay. So the patient is alert and capable of make their own decision.
Yes.
We have not okay. We have checked the competence of the patient and she's able to make her own decisions. Yes.
Good.
So what do you think? What happened to this patient?
Well, according to the management that the patient have received, we are suspecting menopause for the axillary swelling. But the top priority for us is the DVT of the axillary vein. This might be also associated with the PE as the patient developed acute shortness of breath. Also, we suspect also maybe lymphedema as a secondary cause.
Okay, so what is the risk factors for bleeding or this hematoma?
Well, in the case of this patient, as the patient has history of breast cancer, she may be at the state of high risk of cerebral embolism, and she has been admitted to the hospital for a while. So the immobility may be also a risk factor for thrombosis in this patient. Yes.
Okay, so the blood in the drain, it's due to what it's look like, the wound look like.
Well, I will check up and see and get back to you as soon as doctor.
Okay, so what's your plan of action on event of this complication? What will you do?
Well, I first I will do a duplex ultrasound to check if there is any thrombosis, the level and the site of it. If this has been confirmed, I will start low molecular weight heparin therapeutic dose as 1 milligram per kg twice a day for this patient. I will also do complete blood investigation, including CBC, INR, coagulation profile, and liver function and urinary function test. I will also I will check the patient stability, doing an ABCD approach, and check the patient on oxygen and put the patient on oxygen as she is short of breath.
So,
And
is the patient safe? Is it stable to send her for home?
to my knowledge, I don't think that patient is safe to be sent home. I have
Why
talked
she
with
is not able to go home? She is not stable.
yes, the patient is not stable as she has few shortness of breath.
So what do you
And
think of shortness of breath? What does she have?
we might suspect PE as a first lead cause. We also have to exclude myocardial infarction as the patient has a history of low ventricular with left ventricular failure. She also has COPD, so we have to check if there is an pneumothorax or an acute infection.
Okay, and what will you do if she insisted to go home?
Well, I think the right decision is for the patient. So after checking the competence of the patient, I will stick to the decision of the patient. And if the patient is in critical position and have no competency, I will first ask my senior and maybe use consent for.
Okay, and what about the drain? What will you do with it?
Well, I will keep checking the drain and look for the content of the drain, if it's full fluid or it is clear, and I will check for patency of the drain.
So she will leave the hospital with the drain. What will she do with the drain in home?
Well, I will ask my senior and get back to you, doctor.
Okay, thank you.
Okay, thank you, doctor. So, do you need anything? Do you want to recommend anything, doctor?
No, thank you.
Okay, thank you.
Okay, thank you. 1 minute was still left.